Did you know that the fat hiding around your organs could be a hidden culprit behind your chronic pain? I'm Dr. Tammy Penhollow. As a spine and joint pain expert, I'm excited to share groundbreaking research linking visceral abdominal fat to widespread pain. In today's video, we'll break down what visceral fat is, why it matters, and most importantly, how you can reduce it for a healthier, pain-free life. Don't forget to like and subscribe for more insights that can transform your well-being. Let's uncover the connection and take charge of your health. So we're talking today about a study out of the Regional Anesthesia and Pain Medicine Journal. It's titled MRI-derived abdominal adipose tissue is associated with multi-site and widespread chronic pain. Its original research, the author is Z.D. Keifel et al., and this was released in September of 2024. So what we already knew is that obesity is linked to musculoskeletal pain, but the relationship between that excessive visceral and subcutaneous tissue and chronic pain in multiple sites and widespread has not been investigated. So what this study shows is abdominal adipose tissue is associated with chronic pain in multiple sites, widespread chronic pain. There is a sex difference between males and females as well. So how this study was done, 32,000 people. This is not a backyard study. 32,000 people in the UK had an abdominal MRI. With that abdominal MRI, you can see all the adipose tissue surrounding the organs like the colon and the stomach and the liver, the spleen, the pancreas, etc. And you can determine how much is too much. That is delineated from the subcutaneous fat, which is something you can pinch, like that pinch around the middle thing, that's sub-Q fat. And it has a different role in disease processes and risks of things like cardiovascular disease, Alzheimer's, dementia, etc., because the adipose within the abdominal cavity can actually be more dangerous. So let's just define that. What is visceral abdominal fat? So that is the stuff inside. It's something that you can't pinch. So if you look at somebody and they almost look like that traditional egg on toothpicks or the person with a pot belly, and you can't really pinch that there, it's just like this big firm belly, that is visceral abdominal fat. If you can pinch it, like that little pinch at the love handles, a little pinch in the kangaroo pouch in a lady after she's had babies, that is subcutaneous fat. Say you don't have an MRI, say you're not just going to run out and get an abdominal MRI. How can you tell if you've got visceral fat or if you're over fat particularly? So we can, in general, guess that visceral fat is about 10% of our total body fat. So say if you're a body fat percentage of 20% body fat, 10% of that 20 is likely to be visceral. You can do a gross measurements. You can say waist for females greater than 35 inches or in males greater than 40 inches, you're at higher risk of having abdominal fat or visceral fat. You can also do a waist to hip ratio. So you take your waist in inches, divide by your hips in inches. The ratio of greater than 0.85 in a lady or 0.9 in a man is pretty indicative of abdominal obesity. Another thing that people use, doctors use, because they think it may be a little bit more accurate in determining what is sub-Q versus abdominal fat, we can take the waist divided by the height. So they both have to be in the same measurement. That could be in centimeters of the waist divided by centimeters of the height, or inches of the waist divided by inches in height. Healthy is something that's less than 0.5. So that gives you an idea of where you might be because you don't have an abdominal MRI. But what can be shown from this study is that the higher percentage of abdominal adipose visceral fat is that these patients also tended to have greater than 1, greater than 2, typically greater than 3 body pain sites, or which is all over pain. That was another option. And they followed them at an average of 2.7 years after the first abdominal MRI. And they were able to see that as that visceral adiposity or abdominal fat around the organs grew, then the chronic pain and the more widespread pain was greater. And this was even greater in females. So, how do we reduce our visceral abdominal fat? Everybody wants to do that, right? That's the unhealthy. That is something that you don't want to be the little egg on toothpicks who's now at a higher risk of diabetes, stroke, heart disease, dementia, all the bad guys that are out there, potentially even some cancers that are related to visceral adiposity. So the number one things you can do are you address your lifestyle. We've got lots of control when we're addressing our lifestyle. This is on us. This is something we can do. I love that it empowers somebody. So you can exercise. Things that burn fat more likely, rather than a nice, gentle, low intensity exercise, are shaking it up, adding in some that HIIT, high intensity interval training, is more likely to dig into that fat burning mode. You also can maintain, if you're into zones, you can be in that zone 2 for that low, slow burn, but then some of your workouts can be HIIT. So you can optimize things, you can shake it up, decrease the risk of an injury with exercise. Burn that fat, get rid of that fat. The number 2 thing is adopt healthy eating. So that is eating whole foods, lean proteins, fruits, veggies, whole grains, not eating processed foods, not eating the trans fats, the sugars, the white products like the white sugars, the white flours, the white rices. So going with brown rice, going with whole wheat, etc. if you're not a gluten intolerant patient. Also, intermittent fasting has been shown that when the body's in that fasting state, it's almost like a ketogenic state. Guess what? The brain loves ketones. Ketones are a metabolic byproduct of fat. So when people go even onto some ketogenic diets to try to reduce the fat, they get more fat burning because the body's in that state where it's not burning muscle, it is burning fat. So that is a way to reduce the abdominal adiposity. The other way to do it is good sleep hygiene. If you're getting good sleep, then your body is in a decreased inflammatory status. So most people aim for at least 7 hours. You can say, I can sleep when I'm dead. Well, we don't want to accelerate when you're dead. We really need to prioritize and say that sleep is so important. If we're getting good sleep, then we're healing. That's when the body rebuilds. That's when the body takes all those protein building blocks that we've consumed in our lean proteins and turns it into muscle. More muscle begets less fat because muscle has a higher baseline metabolic rate. So it's important to get sleep so you can heal, so you can reduce your stress. Speaking of what, you need to decrease stress. How do we do that? Or why do we even want to do that? Because life is stressful in general? No, we need to say that we're in a high stress state. We are increasing cortisol. When our cortisol levels are high, our body goes into a let's hold on to fat state. And guess what? It tends to go in the middle. I know a lot of people who, once they've reduced their cortisol levels through reducing stress, then they can finally lose that stubborn belly fat. You can't spot reduce specifically, but when you're looking at all these things together, that can help you reduce. Another thing to look out for, because increased alcohol intake is related to increased abdominal adiposity or abdominal visceral fat. So this is all about lifestyle. It's all on you to be able to take control of it and say, okay, good. Yeah, there may be some genetic component. Sure, I can't deal with that because I can't change my genes, but all these other things are related to things I can do. Then as you reduce your abdominal fat, your visceral fat, you can find that the inflammation goes down with widespread body anti-inflammatory cells circulating around, then we're not going to have the inflammatory pain. Pain is an inflammatory response. Arthritis is an inflammatory condition. All these things can be reduced by paying attention to your abdominal visceral fat. You don't have to have the abdominal MRI, but isn't it neat that we've got this study with a large number, it's high-powered, 32,000, that we can say, yeah, we can actually look at the direct relationship between high visceral abdominal fat and multiple sites or widespread chronic pain. Go out there and get rid of that abdominal visceral fat. If you'd like some help with that, know that we can help. One of the things we use in addition to this lifestyle approach, we use the M-Sculpt. And the M-Sculpt specifically on the belly reduces visceral fat. Through a 30-minute session, we do 20,000 very effective sit-ups that are not going to hurt your neck. They're not going to hurt your elbows or your hip flexors. You're not going to be working those. This is high intensity electromagnetic measurements that are contracting the muscles supramaximally, doing above and beyond what you could do. 20,000 crunches in a 30-minute session that is reducing fat and building muscle. So reach out to us if you've got any questions. Do like and subscribe. I'd love to answer any questions you have below. Otherwise, I'll see you next time. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.